Stand by SOT1.
Standing.
10 seconds. Ready, rolling. Ready, SOT1.
Ready.
In 4, 3, 2, 1. Roll in.
From legendary Uncle Studios in beautiful Southern California, welcome to another edition of Work Comp Matters, the central location for you employees, you employers, and of course, we haven't forgotten about you damn independent contractors. And now, here's this week's edition of Work Comp Matters.
It is January 7th, 12 noon straight up. Welcome to another edition of Work Comp Matters. We are brought to you and sponsored by mancavepodcasting.com, where we have over 600 podcasts in the tank. They're completely free, available for you, no obligation, 24/7. And if you want to do your own show, I'm going to ask you for a small chunk of change. But in exchange for that, we will produce, direct, manage, and get it streamed live into the cloud forever. Much thanks to Scott Walton of legendary Uncle Studios for continuing to be my sound engineer for many years before, leading up, and hopefully many years to come. Also, much thanks for Mr. John Scalia out in Munich, Germany, continuing to be my co-host. This is a fantastic day for Work Comp Matters. Now, why, you might ask? Do we have hundreds of thousands of listeners? Heck no, I don't even know if I have 100 live listeners. But I do know that at the United States Supreme Court today, they were holding oral arguments on the Biden vaccine mandate. And there seems to be some basic confusion about this. So I'm here to clear it up for y'all. This is not a mandate that employees must be jabbed. This is a mandate by the Biden administration that if an employer has more than 100 employees anywhere in the United States, that the Biden mandate wants those employees to be vaccinated, or the employers have to fire them. The employers have to fire them. Also, if during a job interview, an employer may not hire an unvaccinated worker. I think this is completely ridiculous. Up until, well, actually, current law through today, the only federal mandates that I'm aware of for hiring and firing are a violation of someone's civil rights. You're not allowed to hire and fire based on age, sex, religion, skin color, race, disability, or whistleblower. If you hire or fire based on any of those, what I refer to as the Title VIIs or the Title IXs, you are violating someone's civil rights. In fact, one of the Supreme Court justices brought up that they got the people that were arguing on behalf of the administration to admit, we all know this, that there is some risk to the vaccine, however small, whether it's less than 1%, there are some side effects, and there is a small risk to taking the vaccine, to being jabbed. And the point was brought up that OSHA, because this is about OSHA, that OSHA never once before has been mandated to regulate employment for anything, nothing that has even the smallest of risks. Whatever OSHA does is specifically for safety of employees. And I'll go to John in a couple of minutes. So, John, take a note. Look back and see if OSHA has ever mandated something for employers that even has the smallest of risks. The U.S. Supreme Court say no. I say no. Now, also, topic of conversation was brought up. How about the flu? Okay, now I'm not trying to compare COVID-19 to the flu. I wouldn't do that. In fact, when I've done it before half-heartedly, I sort of say, like, COVID-19 is the flu on major steroids. But that being said, the flu is the ninth greatest cause of death in the United States, okay, just for the population in general. And OSHA has never before mandated that someone has to get a flu vaccine or they're not allowed to be hired. OSHA has never mandated that potential employees or existing employees have to get polio vaccine, measles vaccine, mumps vaccine, smallpox vaccine. That's never been mandated. And of course, those are completely, I think, in a different category, because all of those vaccines prevent you from getting the virus. We all know that the vaccine for COVID-19, just like the flu vaccine, does not prevent you from getting the virus. It simply minimizes not only the side effects, but also the contagions and contractability. I am completely against federal as well as state, as well as municipal mandates for employers to require vaccines and to hire and fire based on vaccines. Now, that being said, I believe every employer has the right to make the choice for themselves. If an employer doesn't want to hire anybody who's not vaccinated, then don't hire them. It's not a violation of someone's civil rights. And I'm not here to endorse people to get vaccinated. I'm fully vaccinated. People have the choice to do, you can do whatever the hell you want. It's just, if you're not vaccinated, stay the hell away from me. But I'll tell you this, I don't want the federal government, I don't want the state government, I don't want county, and I don't want city government telling me that I'm required to have my employees be vaccinated. That is my personal choice as an employer. And John, I'd love to know what you think, baby.
Well, I think it depends on which country you're in and which social system and which governmental system you're in terms of whether or not the government has the power to make, yeah, go ahead.
I just going to say, I'm referring to the United States, but please continue.
I was getting there, yes. And that's what I was going to say. So I think in a country like the one I live in, Germany, it's perfectly appropriate for the government to say you have to have a vaccine mandate. It's the way it kind of works that way here. America's got a different tradition, obviously. You're right. OSHA has never mandated a vaccine. They probably never will. Americans don't like mandates. And as you and I discussed earlier, we don't think the president has the right to issue a mandate. Again, as you say, the employer is a different matter. So, for example, when they issue a mandate for the armed forces members to get a vaccine, that's the employer issuing a mandate, not the government issuing a general mandate for all the citizens.
However, when you go into the armed services, you lose some of your basic rights. Go ahead, John.
Oh, you lose a lot of your basic rights.
Fair enough. Okay, fine.
But yeah, among them is the fact that, but as you said, you're in favor of employers being able to do that anyway, whether it's the federal government as an employer, not as a government, issuing a directive to its employees saying, as an employer, we want you all vaccinated. So I think in the system you're in, that's probably legally correct. Do I think it's better? No, I think our system is better. In fact, Germany is faring very well, even against Omicron. The infections have gone really up, but we're not really having any severe problems here in Germany with it. A lot less than our neighbors. I mean, Spain's getting hit hard, England's getting hit hard, Italy's getting hit hard, and we're not getting hit nearly as hard. And I think part of it is because we have been pretty good about masking. I mean, everybody wears masks here. Everybody, and every indoors. Everybody's masked. Nobody argues about it, and everybody more or less keeps their distance. and pretty much the population in the parts of Germany that were not part of the former communist Germany, East Germany, is really vaccinated. So that's what I think.
Yeah, and also when you talk about Italy, and you may remember 18 to 24 months ago that a lot of people were dying in Italy, not only because of the advanced age, they live longer, but also because they live closer together. And so
Well,
Italy.
yeah, but actually Germany we may even have more old people in Italy. I mean, as I told you, when I applied for my vaccines, I was not in the first priority group for age because I was not 80. The first priority group for age in Germany was over 80. And then the second priority group for age was my group between 70 and 80. So that's how many old people we've got. We've got a lot. So it was more than that, but you're right. Italy has a lot of old people, but so do we.
There doesn't appear to have been any indication from the Supreme Court as to how quickly orders from the court will be issued, whether or not there will be a stay, whether or not fuller written opinions explaining the court's reasoning will be issued. But given the fact that some of these mandates go into effect next week, the justices could issue some kind of basic order as soon as today or this weekend. It appears that the liberal justices on the Supreme Court, which are four, have continued to defend the federal government's ability to impose the vaccine mandate on workers, but this time in the context of health care. They also heard, in addition to the Biden mandate, they heard about mandates for healthcare workers. Justice Kagan said labor disruptions must be weighed against people not showing up at hospitals because they are afraid of getting COVID-19. Quote, and so they're not coming for their mammograms, they're not coming for their colonoscopies and so forth, she said. So there has to be a balance of those health benefits against what you say are these labor disruptions. Should it be that we decide, as against what the secretary has decided in performing his important function of evaluations, these potential disruptions, and weighed those disruptions against the health benefits that he sees in the rule? You know what? I realized that what I just read didn't make a lot of sense. I apologize for that. I'm going to try one more and then we'll come up to the break. Justice Gorsuch asked a series of questions about the impact of the vaccine mandates and how it can be viewed potentially as controlling the employment of healthcare workers, which is not allowed by law. Quote, this regulation affects, we're told, 10 million healthcare workers and will cost over $1 billion for employers to comply with, he said. So what's your reaction to that? Why isn't this a regulation that effectively controls the employment and tenure of healthcare workers at hospitals? At issue, Congress said the agency didn't have the authority that should be left to the states to regulate. This is my solution. If I were on the Supreme Court, I would simply say that even this is going against what I said earlier, but I would say something like, or if I were Congress, I would make a law that employers cannot knowingly allow someone to come to work that they know is contagious. But that's probably really, really stupid. You know what I mean? Once again, I'm totally against federal mandates for hiring and firing, except when it violates someone's civil rights. John, you want to respond for 60 seconds before we go to the break?
No, I just think it'll be interesting to see what the court does. It's obviously a contentious issue, and we have a saying that you probably learned the first year of law school, not the first week, which is, hard cases make bad law.
And I just got a response to a listener to what I just said, I think, and Here is the response. The issue isn't whether the OSHA mandate is good policy. The issue is whether it has the power to issue the mandate. I will add that the answer is clearly no for several reasons, which are not enumerated. And I have to agree. Again, it was asked before, has OSHA ever issued any type of illness or virus or vaccine mandate for hiring and firing? And the answer is no.
No, they haven't issued one here yet either.
Oh, got it.
Yeah.
Yeah. You're dialed into Work Comp Matters. We provide current events and news for you employees, employers, and of course, we haven't forgotten about you damn independent contractors. We have over 600 shows at mancavepodcasting.com in the tank, and they're yours completely free, no obligation. And if you want to do your own podcast, we'll go ahead and manage, produce, direct, get it into the cloud forever, and streamed live. And now, here is your Work Comp Matters news.
Democrats revive bill for universal health care in California. When I saw this, I said, wow, what a great column for a socialist to read. California would enact a sweeping, first in the nation, universal health care plan under a proposal unveiled Thursday by a group of state Democratic lawmakers, providing health services to every resident and financed by a broad array of new taxes on individuals and businesses. Though some of the policy details of the ambitious plan were laid out last year, the way to fund it had not been determined. The proposal, now laid out in separate pieces of legislation, faces significant hurdles in the coming months. First, at the state capitol, with opposition from groups representing doctors and insurance companies, oh, color me surprised, and then possibly at the ballot box, as voters would have to approve the taxes in an amendment to the California Constitution. There are countless studies that tell us a single-payer healthcare system is the fiscally sound thing to do, the smarter healthcare policy to follow, and a moral imperative if we care about human life, Assemblyman Ash Calda, San Jose, the proposal's author, said Thursday. I think the article goes on and on. This is what I've been saying on this program for years. I've pointed out that not only do I think healthcare should be a human right, as it is in Europe, but that the system in Europe where you get complete healthcare is actually cheaper than the system Americans have. That the average American pays more for a policy with deductibles than the average European pays for complete coverage. I mean, economically, there really is no argument.
Well, not when you put healthcare on its own, but when you talk about how much you're paying in taxes, people in Europe end up paying about twice as much in taxes, right?
No, they do pay a lot, and I don't know how much more in taxes, but the difference is what you get. What you get in Europe is you get, in Germany, for example, you get free education all the way through PhD.
Yeah, but John, that's not for every student. Those are only for students that actually qualify. If you get crap grades, you're not going to be able to get fully funded to PhD.
That's true. But on the other hand, you are going to get incredible government programs for job training. You're going to get incredible state aid if you're unemployed. I mean, the pandemic did not cause hardship for individual Germans the way it caused hardship for individual Americans because of the social.
And in fact, if you are a successful plumber or electrician, where it only takes 2 years of vocational training, arguably, and you've got clientele here in the United States, you can be banking $250,000, $300,000 a year. You don't need a PhD.
Well, and in Germany, plumbers make really good money. And I've had both plumbers and electricians come to my house, and I know what they charge. They charge a lot. So the service people in Germany make really good wages. But the point is that the social safety net is incredible, and the German government, by the way, runs in a surplus. Now, I don't know. Yeah. And that was part of the reason that Trump and every president before him has bitched at Europe for not paying its fair share of the NATO bill, which I agreed with, by the way. Europe hasn't paid its fair share, and they've committed to doing it, and they haven't lived up to the commitment. But and that's unfortunate and it's wrong. But the reality is, even if they did pay their fair share, they would still probably be running the government at a surplus. I mean, that's how efficient and profitable the government is. So you get you get what you pay for, as they say in your country.
I think they say that in every country. Maybe I'm wrong. I don't know. As the Omicron variant of COVID-19 spreads rapidly in California, hospitals are filling up and expecting even more patients, including pediatric cases. Hospitals statewide have seen a 165% increase in COVID-19 admissions in the last month. But just as a Steve Appel reminder, if you take the admissions now, they're probably lower than they were a year ago. But I will continue. According to January 6th state data, case numbers are still less than half of. Oh, look, there you go. See, I got too fast. Case numbers are still less than half of what they were at the peak of last winter's surge, but that's expected to change. We are on track to exceed last winter's peak of hospitalizations, said Kayomi Burchill, Group Vice President for Policy with the California Hospitals Association. I don't agree. No, I don't think that we may be on pace, but we're not going to exceed this same time last year. Go ahead, John.
Well, interestingly, based on the title of the group, California Hospital Association, I assume that's an employer group, and certainly not.
Right.
Okay. 5 UC campuses extend remote instruction through January and amid worsening Omicron surge. Amid a worsening Omicron surge, UC Riverside on Friday joined 4 other UC campuses in announcing that they are extending remote instruction to the end of January. UC campuses at Riverside, Irvine, Davis, Santa Cruz, and San Diego, whose winter quarters began January 3, said that rising positivity rates for coronavirus infections had compelled them to exercise extra caution and push back the start of in-person instruction to January 31. Davis had planned to return to campus on Monday, while Irvine, Riverside, Santa Cruz, and San Diego had announced a January 18 start. Navigating the challenges of another COVID-19 surge is certainly a difficult way to start another year, UC Riverside Chancellor Kim Wilcox said in a message Friday. The Riverside campus remains open, including the library, rec center, and student union building, and in-person research and student services are continuing. But again, the Omicron surge is putting a real strain on the instruction, and I feel sorry for those students. I mean, to me, I can't even imagine not having the in-person experience that I had when I was going to college. I mean, it was invaluable. I went to a fairly small university. We all knew our professors all knew us. And the idea that I would be looking at a television screen just would have completely altered what my undergraduate education was.
Oh, absolutely. When I was going to college, John, I mean, I was there to learn, but I definitely wanted some human contact. Okay, let me tell you. And every day, speaking of human contact, COVID-19 cases in California are exploding, much like they are throughout the rest of the country and world, thanks largely to the incredible contagious Omicron variant. Boy, it sounds like the friggin' boogeyman, you know what I mean? Which is a little more than a month, has invaded our lives, easily claiming its title as the dominant strain of this infernal virus. On January 1, for instance, the state reported a 7-day average rate of 130 cases per 100,000 residents. That's a roughly 6,400% increase from the 2 average cases per 100,000 reported during the first week in June, just 7 months ago. The massive jump prompted state officials on Thursday to extend California's indoor mask mandate by a month through mid-February as a growing number of hospitals, agencies, and schools face severe staffing shortages. Okay, now, John, I've got a question for you. Obviously, all the news is on the Omicron. Omicron this, Omicron that, more contagious than ever. Everybody's getting it. We all know, of course, that Delta is more deadly. You're going to have more severe side effects. You may have permanent damage. John, here's a quiz without looking at the internet. What was the original name before Delta? That's what I thought. Crickets. It's gone. The original COVID-19 is gone. Nobody talks about it. Nobody got it. Remember when Delta didn't exist and we just had original COVID-19? Where is it? It's gone. Now, guess what? Omicron's coming onto the picture. Yeah, people are still getting sick. People are dying. I don't mean to minimize that. But as Omicron continues to take over, Delta is going to slowly disappear also. And then we'll be left potentially with only Omicron. And nobody disputes that the side effects, the mortality rate or the death rate, hospitalizations are considerably less from Omicron than from Delta. There's an outside the box Steve Appel point of view. What do you think, John Scalia?
Well, I think that eventually it's going to turn into the flu, and it's going to wreak havoc on the way there. It's probably going to kill more old people than would have died otherwise. But as I've said many times in this program, being an old person, old people are supposed to die. I mean, that's the way life works. But it'll accelerate the death curve among old people. But as you pointed out, the flu kills millions of people every year, and they've never been able to find a cure for it, even though we get flu shots. I got a flu shot this year. I almost never get a flu shot. And the only reason I got a flu shot this year was when I split my knee open. I went to my doctor, and he's an internist, so he had to refer me to an orthopedist. But before I went, he says, "By the way, I can give you this shot, but I got a flu shot."
But the one positive thing about Omicron, but you're not going to hear this on the news, is that Omicron continues to further permeate our system. Delta is slowly but surely fading away. And once Delta eventually completely fades away, like that first one that neither you or I can remember, and now we have Omicron, maybe something else after Omicron will become a new variant and more contagious, but it's going to be less deadly. John, we got about 2.5 minutes left. Take your last story or whatever.
Okay, coveted COVID tests say that 5-10 times fast. Coveted COVID tests.
Yeah.
Our traffic jams as Omicron explodes in Bay Area. Waits longer than a week for PCR tests. A lot of people are frustrated. On Wednesday, the backup on the Auto Mall Parkway was 4 hours. On Thursday, it was shorter. But Devin Chandani gave up, found a place to park, and walked to Irvington High School instead, all to get his hands on one of the most coveted items in any medicine cabinet on the planet, COVID-19 tests, so his kids can return to school when class resumes Monday. And it goes on and on. Again, these tests are all over Germany. I can go down. Well, I can go to where I get my daily cappuccino, and there's a testing center there. I saw a testing center where I have my bus transfer post the other day, not very far from here. And the simple tests are free. The PCR test, the antigen test costs money, but they're widely available in Germany. I don't understand why America is in a situation where it's having problems providing tests. It boggles my mind.
Yeah, well, probably the same reason why when Gavin Newsom spent over $1 billion on masks, I haven't seen a single mask.
Whatever. It's just, it's just incredible to me that the richest, basically still the richest country on earth, and certainly the most powerful country on earth, can't provide something so basic to its citizens.
I completely agree with you. Okay, John, burning thoughts, closing desires?
No, I guess it'll be interesting to see what the Supreme Court says on that. It's also going to be interesting to see what they say on abortion.
There you go. Absolutely. Okay, well, it's been another fantastic edition of Work Comp Matters. Thank you, everybody, much for listening. For Scott Walton of Legendary Uncle Studios, John Scalia out in Munich, Germany, all the good people back at mancavepodcasting.com. My name's Steve Appel. We'll see you again Monday live for another edition of Work Comp Matters. Bye, everybody.